So throughout the COVID-19 pandemic, I've had a lot of people who were interested in taking ivermectin. And so this has become a big question as to whether ivermectin does anything for COVID-19. I've also heard and read a bunch of theories about how ivermectin may help. I think that the effect of ivermectin directly on COVID-19 is a really far-fetched idea, and it does not seem that at levels that you could get ivermectin into your bloodstream, it would have any antiviral effects. However, that does not mean that it will not help people who have COVID-19 infection. And this goes back to the idea of co-infections, the cooperative infections that make some people get COVID-19 and end up in the ICU when they're present, but when they're not present, people get COVID-19 and they don't even know they have a problem. So those co-infections could potentially be the way that ivermectin helps people overcome COVID-19 or even long COVID. And that would be if the individual who's affected by the illness happens to be infected with parasites that are cooperative with COVID-19 in causing disease. Now, the data that comes out of South America and Central America, where people have much higher loads of parasites, seem to be much better for ivermectin than the results we get in the United States. We have fewer parasitic infections. However, even in America, somewhere in the range of 20 to 25% of adults have infection with toxoplasmosis. And I have a different talk where I go into detail about toxoplasmosis and how it can cause neuropsychiatric illness. But if this were acting as a cooperative infection with COVID-19, then it would make sense that reducing the toxoplasmosis load in your system would help to reduce your symptoms of COVID or long COVID. In addition, some of us have intestinal parasites, and these intestinal parasites can become more active during an acute illness of another type. And when they become more active, they might allow the entry of some bacteria from our intestines into the bloodstream. And so another potential way that ivermectin could help is by reducing the intestinal parasites, thus preventing those bacteria from coming in, and then reducing the work that the immune system has to do because it's already busy fighting COVID-19. It doesn't want to get busy fighting off the bacteria coming inside from your intestines. So I think it's important to keep an open mind about ivermectin, but it is certainly not something that I would use as a first-line agent in anyone, but those who do test positive for parasites probably should be treated with ivermectin.